So my name is Greta Hoffman. I am 76 years old. I am married to Jan, and I have 3 children and 6 grandchildren.
In 1986, Greta was diagnosed with multiple sclerosis at Rikshospital University Clinic in Oslo. Unfortunately, she had a primary progressive MS, and no treatment was offered.
I have never got any treatment in Oslo. Nothing. Not because they have a lot of treatments, but they don't find anything what was for me. 9 years ago, I felt I got worse, and the university clinic in Oslo couldn't do anything. So I got to a Facebook group for MS patients, and there I find the name of Professor Slav.
In 2000, Greta's condition worsened. As a clinic in Norway could not offer her any treatment, she started looking for information about stem cell treatment and turned to the Biotherapy International in Israel.
He used my own stem cells and expanding them. So I got my own expanded stem cells first time.
After a few days, the first improvements were observed. Greta entered full remission and experienced no disease progression for 5 years.
But when I did go over the airplane in Oslo, I felt something has changed. I was really better. After 1 year, it was back to normal. I will say normal. But what was very good, 5 years long, it was constant, no progression.
Unfortunately, after a long remission in 2021, Greta started feeling worse and contacted Biotherapy International again to get stem cell treatment.
Because just before this corona time, it started getting worse. I had a telephone call with Slavin, and he told me I would really recommend you to this time to take these placenta umbilical stem cells because they are much more potent. Because of my age, my own is not so potent anymore.
In 2021, Greta underwent one more treatment. This time, she received allogenic mesenchymal stem cells. She got good results, which allowed her to maintain a good quality of life.
The reason why treatment with mesenchymal stromal cells can be of help is because of 2 purposes. First of all, since multiple sclerosis is an autoimmune disease, it is important to turn off the inflammatory process to stop the attack of the central nervous system by patient's immune system, because it's an autoimmune disease. The other theoretical explanation why treatment with mesenchymal stromal cells can be of help is because we have shown under laboratory conditions that treatment with mesenchymal stromal cells may be effective because the cells can differentiate into neural cells. These are the cells that secrete myelin. Since in multiple sclerosis, the end result of the inflammation is demyelination, if we can inject cells that can generate myelin, maybe we can reverse the process by remyelination. The treatment consists of administration of mesenchymal stromal cells simultaneously, both intravenously, so that it will go all over the body and have a chance to regulate the self-reacting immune system, but also injection intrathecally into the spinal fluid that circulates through the central nervous system, such as cells can easily reach the central nervous system. Usually, after the treatment, within the next few weeks, if the treatment is successful, patient feels much better due to turn off of the autoimmune process, and at a later stage, potentially resulting with remyelination, if the mesenchymal stromal cells can be differentiated in vivo in patient's central nervous system into myelin-producing cells. By now, we can treat patients that receive the cells with 3 additional non-invasive machines. One of them is deep transmagnetic stimulation, which stimulates the central nervous system and can be effective even without cells. And we believe that in combination with cell therapy, it would be much better synergistically. The other machine is low energy acoustic shock waves. It causes dilatation, widening of the blood vessels, and consequently the flow of cells into the target organ improves, whether it's into the brain or into the spinal cord. The third machine is low energy laser light therapy. Laser light can activate the function of circulating cells. We know that the energetic status of the cell can be improved by light. So you improve the function of the cells by providing more energy much faster.
If other patient want to do the stem cell, I would absolutely recommend Slavic, because I trust him and he's doing the best for me.